Welcome to the Protecting Your Nest podcast. For those of you who have been enjoying this podcast, you already know that my focus is on understanding the root causes of disease. That's why I created my NEST and ROPE acronym. So far, we've talked extensively about nutrition with guests like Michelle Hearn, the fasting with Dr. Jason Fung, exercise with Alicia Archer, sleep with the sleep doctor, Dr. Michael Bruce, and episode number 14 of the podcast focused on the other T in the nest, how we think. Achieving your ideal state can be challenging at times, but just imagine how much harder it would be if you're a victim of trauma. That's why today we will focus on the other T in the nest, and that T is trauma. I did not have to search very far to find today's guest because my health system, that's AdvocateAurora in Wisconsin and Illinois in the U.S., has a trauma recovery center. So I asked my good friend, Dr. Kim Miller, who is the director of the trauma center, to consider being on a podcast. She said, no, not me. I have a wonderful lead clinical psychologist, Dr. Victoria Smoter. So Dr. Vicky has been with AdvocateAurora for over 20 years, and during her psychology residency served as a chief psychology resident. That means she was one of the smartest, docs in the group. And prior to that, she did her adult behavioral health doctoral intern with primary care psychology associates after attending Chicago School of Professional Psychology. She also attended undergraduate at Washington College and got a bachelor's in clinical psychology. So she's been trained a whole lot in psychology. So it is my pleasure, Dr.
Thank
Vicky,
you so much for having me.
Protecting Your
I think
Nest.
this is such an amazing thing that you're doing to get health and wellness information out there to people, and I'm really excited to be here.
Yeah, I'm excited too. I was so excited when our health system decided to dive a little deeper and do this work. So it's going to be nice to talk a little bit about it. And for those who are checking out the podcast, rather on YouTube or in your podcast app, just want to let you guys know I did write an article with the diet doctor. Many of you know I have a low carb corner, and trauma was the topic. So it'll probably be coming out around the same time as this podcast. And, some of the stuff I talked about in the article is, looking at the difference between just trauma, major trauma, micro traumas. I shared a cool story about trauma in an obesity clinic. As you know, I'm really a big fan of helping people with obesity. We talked a little bit about the neurobiology of trauma. And what's really cool with that article, there's a link to a cool tool that'll help you determine if you've had previous traumas, how it may have impacted your life. So make sure to check that out, and I'll make sure to have a link in the show notes. So Dr. Vicky, let's get started with our conversation. And I want you to start by telling me a little bit about why you decided to take on a career in the mental health space, and particularly why trauma has been a big part of the work you do today as a clinician.
One of my honestly least favorite questions to answer, because I don't have a really good story like some people do who work in the mental health field. I was an undergraduate double major in English and philosophy, and my father sat me down and said, "What are you going to do? I need you to pick something a little bit more practical." And I said, "What's the closest thing to application of philosophy?" And I took a psych class, and I fell in love with it. And, since then, I really have, as I've gone through my doctoral program, my undergraduate, my clinical trainings, been drawn to individuals who have experienced adversity and trauma, because you can't get away from it. It is something that has such a far-reaching impact in terms of prevalence, in terms of the way that it impacts our interactions with other people, our bodies, our physical health, our mental wellness, our spiritual health. There is such a huge impact, and individuals who have experienced trauma or lived in communities where trauma is more prevalent also don't always have the best resources to get help and to get care. So that's something with our program, the Trauma Recovery Center, the TRC, that's been amazing and really, kept me rooted. Is we're able to provide services to trauma survivors at no cost. So being able to get high quality care to individuals and let them know that what they're experiencing is a normal response. It's something that our brains and bodies do to help us survive. And sometimes they just do too good of a job at surviving. So really being able to see that change in people when that clicks, that it's not a problem, it's not a deficit, it is their brain protecting them. And here's what we can do to help it feel a little bit better has been, huge in keeping me in trauma work.
Nice. And I think anybody who thinks of trauma will have a lot of different perceptions about what that means. And so I think maybe another thing we should start with is just a basic smart doctor definition, chief resident doctor definition of what trauma is. So give us a little bit of a
So we
definition to
work
kind
off
of level
of the
set this
SAMHSA definition
conversation.
of trauma with our program. So it's really individualized. It is defined as by the three E's. So an event or series of events or circumstances that is experienced by a person as being psychologically or physically harmful or threatening and has lasting adverse effects, which is the third E, on their functioning in terms of mental wellness, physical wellness, spiritual wellness, and overall areas of functioning.
Got you. When you think about, I'm just thinking about, driving down the street and I'm, traumatized because a cop is pulling me over, right? And they haven't done anything to me, but would you consider discrimination, maybe homophobia,
Absolutely.
those types of things as traumas as
So if we
well?
think
As
about
well?
there's those acute traumas that are what we typically think of as what can cause or what does cause post-traumatic stress disorder, like a gunshot wound, a stabbing, combat stress. And also, we have learned experiences. So, cumulative, like trauma and traumatic stress, is a cumulative response based on our learned experiences. If something feels like it is threatening our psychological or physical safety, and then that the effects of that event or that experience continue on and have those negative effects, it's something that's considered a trauma. Would it meet criteria for PTSD? Not necessarily, right? But if you feel your heart rate increasing, you're getting worried, your hands are maybe a little bit sweaty, you're having that physiological stress response, and it doesn't stop when the stress or when that cup goes away. And it's based in intergenerational trauma of my experience, or I shouldn't say my experience, but your experience
Mm.
in that situation may be that it is not safe as a person of color to get pulled over by a cop, regardless of how the interaction so far has gone, right? That's learned information that then changes how your thoughts go, how your body responds, and how safe you feel in that same situation. Whereas somebody else might feel totally safe, and that wouldn't be a trauma because they don't have that same background or learned history. So absolutely, those different relational things.
Got you. That helps a lot because I was definitely, oh yeah, it just makes sense. So, yeah, just trying to, the irony is that again, I think most of us thought, military, blah, 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 that's PTSD, but it sounds like a lot of scenarios can give you PTSD. It doesn't have to just be some dramatic, explosion from the military. It can just be anything that your body perceives as a trauma. So that's very good to know. So now, a lot of us have family members who have had traumas and we really want to help them, but we don't really know how to help them. So what can just a regular person look for in a person who they're concerned about, but they're not sure to help them identify that this
Sure.
person
So
may
if we
be
think
having some
about
trauma issues?
what may be externally visible or visible to us as a friend or family member of somebody who could be struggling and how we can help, we want to think about, has there been a behavior change? Is this person somebody who is normally pretty chill and they're flying off the handle or feeling really agitated or visibly they're kind of jumpy, they're changing their behavior in terms of they were always in the middle of stuff, wanting to go out and everything. Now, some of that has changed because of collective trauma of the pandemic and feeling comfortable with being out and about and those things, right? But is that person more withdrawn? Are they isolating more? Are they saying more things that are negative about themselves that would indicate maybe I shouldn't have been here when that happened. I shouldn't have done that. I should have done something differently that would have stopped something else from happening. Or even some of those changes where somebody's spacing out a lot, they're not getting good sleep. They're telling you that, they're feeling more jumpy, they're not sleeping well, they're having bad dreams. And something that can help, without being a psychologist, a therapist, a medical provider, is letting somebody know that that's okay. It's uncomfortable, yes, and it's okay because it's a normal physical, biological, neurobiological response, and helping them to calm down and stay present as much as possible. When people are having those, even blowing up at authority figures or difficulty communicating things or building those basic trust and communication skills, or if those have changed, helping somebody to have space, not be reactive in our response to them. And with loved ones, it can be hard too, because we're like, what's going on? And then our response plays off their response, right? If we can take that pause, that breath, and help somebody slow down, stay present focused, and what is it that we are trying to get to? What are you trying to communicate? What are you needing right now? And sometimes it's as simple as, hey, can we just chill out for a quick second, go for a walk together, or go grab a cup of coffee or a glass of water to take care of those basic physiological needs. Sometimes when we're really activated, those go out the window. So helping somebody know you're not broken. This is a normal response when we're really stressed out or have a trauma. What do you need right now? And how can I keep you present? How can I keep you here with me in this moment? That scary thing isn't happening. You're more or less safe right now. How can we get that need met?
Yeah, that's very cool. I think we definitely want to help. I think we want all hands on deck, right? We want, if we get family members aware of this, that'll help clinicians, and we want clinicians to have some awareness as well. As I'm, thinking about your work and my work, and you just shared with me, which is kind of embarrassing, but you told me, hey, by the way, my clinic is right next to yours across the street. And I didn't even know you guys, are in the building across from mine, which is really cool. So I'll definitely be able to come visit you guys. But when you think about the time that we have with patients, I have 15 minutes for an appointment, right? And I'm thinking I really need to know this well so I can help my patient. So my question to you is, when you guys see people, how much time do you have? And just like with that family member, are there differences in what you're looking for that'll help you? Because you don't know them like the family member. So how, as a clinician, are you able to identify
That is
people
such an
who have been
excellent question.
traumatized?
And I'm a little bit different than medical providers. I'm amazed by how well, family medicine and internal medicine docs know their patients and manage their time. So with the Trauma Recovery Center, we start with an hour and a half to 2 hour long intake where we really get to know somebody. And then we have up to 16 sessions of 1 hour therapy sessions and social services support that we do. So we have a lot more time. We also do have a hospital-based behavioral health service where we have less time. We maybe spend 15 to 30 minutes with somebody initially. So from a trauma-informed care lens, what we do is we assume that everyone has experienced some type of trauma. We don't need to know all the details of that trauma experience. It doesn't have to be a big T trauma, but trauma is so prevalent. We've all experienced something that falls on the spectrum of a traumatic experience, whether it's a relational trauma or a relational failing, to something that's going on intergenerationally, to something that's in our community, to something we've experienced firsthand. So keeping in mind that when somebody responds a certain way to something that I ask, something that I say, it may not be about me. Most times it's not about me. If the response feels way too big for that interaction, and taking that step back to say,
Mhm.
hey, I think maybe something else is going on. And if it's not your role, your scope, or you don't have the time, encouraging somebody, planting the seed to look a little bit further into it and talk to somebody to get some support. It doesn't, again, have to be a therapist, but talk to a trusted, supportive
Cool.
person.
That makes sense. And I think I'm assuming you get better at this as you've done this work over the years, right? You can kind of feel your way through it better. All right, cool. What about when it comes to you know, you have somebody in front of you who you're concerned about, rather it's a family member or a clinician, and you're thinking, okay, this person looks like there's some issues with trauma, but man, in order for them to really open up, it requires building trust. So you have more time than I have, but what tips can you give clinicians or even family members? You know, what can you say to people?
Yeah.
What do you do to
And
build that
again,
trust so
it's a
they'll
little
open
bit
up?
different depending on the scope. Like clinicians, it's a little bit different than family members or somebody in your social network or a colleague. And I think the biggest thing for building trust is showing safety, respecting boundaries, and being transparent. Letting people know why you're asking, that you genuinely care. So societally, we're conditioned when somebody asks, "Hey, how are you?" It's always, "I'm fine." So asking twice can help actually build trust in that you are showing in that moment, you're demonstrating that you really want to know how somebody's doing, and then just listen in a non judgmental way, make some space, and be consistent in that. Hey, this is not something that I have a lot of time to go into as, your primary care doc, as your GP, and I care about it. So I want to give you this resource to get connected elsewhere. I want to encourage you to look more into that. As a family member, that non-judgmental stance, not I'm trying to fix you or give you advice, but I'm going to ask twice. Respect if you don't want to talk about it, give you that space, and then come back to it if it makes sense or if it's necessary.
Cool. So that helps. And again, I just think even when I'm talking about low carb diets, right? I try to build trust. I try to get to know people. I don't want to just, people walk through the door and immediately jump to that. You have to kind of feel people, and people will let you know. Just like if I walk into a room, you can kind of feel stress in the room if it's there. And you can also feel joy and happiness. So I think you have to kind of understand who's in front of you and what their needs are in that moment. So that's definitely helpful. Another thing as a clinician, and I'm sure a lot of the people watching or listening want to know, is let's talk a little bit about the biology of trauma. In other words, what happens to our brains when
Oh my
we've
gosh. Okay,
experienced
so
trauma?
I'm going
Any
to nerd
insights
out
you can
on
share
this
about
just a
that?
little bit. So feel free to cut me off if it's getting too neuropsych geeking out. So with our brains are so cool, right? They're meant to keep us alive, they're meant to respond, and our stress response is actually something that's incredibly helpful. So it keeps us motivated, it keeps us engaged, it helps us pay attention, and it's there to protect us from things like, if you even think about having the experience of starting to cross the street in a crosswalk and a car doesn't stop in time, or it's looking like they might not stop in time, your alarm system, that part of your brain in the back here that's meant to keep you alive, it pulls the alarm, your heart rate might go up, you jump back, and that you get a shot of adrenaline and cortisol that's going, and then you kind of calm down. But it keeps you safe, right? It keeps you alive in that moment. Most of us move forward from that after a couple of seconds, maybe a couple of minutes where we might feel shaken up. What happens with trauma is that alarm system, that survival mechanism in our brain stays on because we have experienced something, either like a series of events or circumstances that cause us to feel unsafe or not be sure that we can be safe enough to activate our parasympathetic nervous systems or our body's natural relaxation system. And or it's a big T trauma like a car accident or a medical injury where you end up in the hospital, or with a broken bone or an injury, or you feel like your life and your well-being was threatened in that moment. Our brain doesn't know what to do with it. And it actually stores that memory and that information in a completely different part of our brain. So the HPA axis gets activated, which is the part of our brain that is responsible for fear and really strong emotions. And that's where that memory gets stored, which is why we have things like re-experiencing flashbacks and nightmares.
Before you continue, Define what that axis. Be
Yeah,
more
so the
specific
HPA
about what that
axis is
means. The axis, yeah, so
the
people will know.
hypothalamic pituitary, adrenal axis. There we go. It is related to our body's
Yeah,
endocrine
right.
system that releases the
Yeah,
stress
yeah.
hormone cortisol. So what happens
Mhm.
basically, something that feels unsafe to us
Gotcha.
happens, or something that is perceived as a threat happens. That alarm system, that sympathetic nervous system gets activated in the survival part of our brain. The front part of our brain that's responsible for like memory, logic, reasoning, emotional reasoning, concentration, that shuts down because all of our resources go back to the back part, our lizard brain, to keep us alive. And then we release cortisol and adrenaline in our brains and bodies. If that doesn't go off, there is continued inflammation in our brain. It can be harder to relax. We can experience brain shrinkage, actually. So your brain can get stuck on so that it's harder to relax. You can have memory and cognition difficulties and impairment. It can change your mood. It can be harder to feel the positive things because our neurochemicals get all imbalanced. So what happens is when we tell our brain we find ways to increase resilience, release endorphins, those happy chemicals, and those relaxation things, and turn off that survival part of our brain, we can actually repair a lot of those stress related and trauma related changes in our brain. So it can be a cycle, and it comes from our brains and bodies not knowing what to do. Our society has evolved way faster than our brains, and we have biologically. So we are experiencing a lot more traumatic stress and in different ways. So when our brains feel unsafe or threatened, that alarm system stays on. We can do things to help our brains know we're more or less safe, we're more or less okay. We can take a deep breath, we can relax, and that helps to rebalance out our chemicals, reduce inflammation, and reverse some of those changes in our brains.
Cool. Yeah. I just think about, like, so if we activate this, hypothalamic pituitary axis, and I know I use so many abbreviations, I can't keep up with it after a while, but it's like it's okay. It sounds like you're saying it's okay if it's there to protect us, right? But if we
Mhm.
overactivate it, it's like it's too much, and then if you keep it activated, it's too much. So it's like chronic stress is a previous trauma. You don't know how to turn it off. So that's very helpful. And I'm glad you nerded out a little bit on me. Yeah. And that's probably why you became a doctor, because you like stuff like this. So, and I think we talked a little bit before we started about a cool TEDx video that will simplify some of this in 4 minutes. So I'll make sure to have a link in the show notes, and it's called How Chronic Stress Affects Your Brain. So it's a nice TEDx that kind of goes into it a little bit and shows a little bit of these,
Mhm.
hormonal neurotransmitter reactions that occur in the brain. I think it really just helps to understand it. So we understand a little bit of the biology now, and if I'm looking at a person in society, rather it's at work or, on the elevator or whatever, a person that's been through trauma, how would I expect that person to react in society where it's kind of, I have to at least think that person may have had trauma. And one thing that's cool about knowing this is that, um, when people do things that
Mhm.
bother you, sometimes there's a reason for it, right? And if you know the reason, then maybe it won't bother you so much because you understand the root cause of why they're behaving. So give me a couple of examples of what to
Sure.
expect with person if
So
they've had trauma in
just
their
to
life.
use a really general example of those cumulative stress effects, and I really like actually talking about the biology because it also gives hope that we can change that, right? We can rewire our brains to release different chemicals to reverse some of these effects. If you think about it and a time period in your life that you've been really stressed out, that maybe you felt overwhelmed, you've had a lot of pressure, there's been a lot of things going on where maybe you haven't been sleeping so well, or, it's just felt really overwhelming, really big, really isolating. really like things are causing you to feel more annoyed or irritable, or you have a shorter fuse. And then one thing happens, like maybe you're at work and you knock your coffee over. And typically the response would be, oh, oopsies, like, let me clean that up. But the response in that moment, because you're so activated, is to flip the whole table over or something like that. So that's an example of how our chronic stress levels can impact and how it might present. So when you see those big explosive responses, when the situation is much smaller, right? That's not a normative response to spilling coffee. And that indicates that there's something else going on. It's not just about the coffee, it's about all of the things that are going on. For somebody who has experienced an acute trauma or one of those big T traumas, it may look like, let's say you get in the elevator, somebody may back up into the corner of the elevator, even past social distancing and pandemic related protocols. They may be staring at you the entire time that you are in the elevator together to make sure that you are not moving towards them, that you are not doing anything that would make them unsafe. They may be, looking you up and down and keeping an eye on you out of the corner of your eye. And it's not because something's wrong with you or because they're trying to start something or because of anything besides they want to keep their eye on you because in their brain, you are a potential threat. You are activating that survival mode in their brain right then because they don't know you and they don't know what you're going to do or how they need to respond. So they're priming themselves actually for that fight, flight, freeze response of how can I make sure that I am keeping my eye on that person, making sure I'm safe. If you do something like reach into your back pocket to pull out a phone, you might notice them flinch or make a sudden movement. They might startle. They may tell you, hey man, back off. Even though you weren't even approaching them, right? You were pulling your phone out of your pocket to check a perfect serve or something like that. So when we see somebody out in society who is looking nervous, looking around, eyes starting, if they have really closed off body language or posture, or like they're backed up against a wall, for example, if somebody is looking like they're totally just checked out and disengaged, they may be dissociating because they're feeling overwhelmed in that moment. There's a lot of those different behavioral things that we can look for. But if you're thinking, wow, that was a really weird interaction, chances are it may be because of a stress response or a trauma response.
And I think this really helps just to exist in society. If we can just walk around and just assume people are dealing with something, I kind of suggested that a moment ago. I think it'll just help us just navigate in the world because, everything has a reason. And so if we can think that way, we won't judge people. And, as a doc who focuses on obesity, right? I had to, and I think I'm a nice guy, right? But I had to train myself how to not judge my patients who were overweight, not blame them I just have a different perspective. And it took understanding why some people struggle. Sometimes they have a processed food addiction. I'm hoping to do research in the world of processed food addiction. Now, if I know that, I won't judge people. So if I see somebody on a elevator moving away from me, just knowing that that's a potential cause of that. I mean, I may think, well, they're moving away from me because I'm African American male, and it may have nothing to do with that. But that's just from my perspective. I'm thinking, well, they're afraid of me or they're racist or something. And just hearing you talk about this is helping me to open my mind to other possibilities. So I appreciate that, and I hope people who are watching or listening that we can kind of grow together. And when you learn new information, then go out there and practice that and say, well, let me see when I'm in the environment, let's pay attention to we're gonna all become psychologists and learn how to see the world through the lens that you have. So let's flip this now. Let's think about not just, what we talked about in terms of how they react. Let's talk a little bit about how the world sees them. And so a lot of times, just like I gave you the example of a person that's overweight, I may judge them. I may treat them differently. I may not even, they may have lost like 100 pounds and I'm still saying, you don't care, you're not working hard enough, and they lost 100 pounds, because I'm only seeing what I see in front of me. I don't see the progression. So when you think about how the world views traumatized people, how do you think they view these people? And give me some examples of what that looks like.
Oh, that is such a good question. I think it depends on where the trauma comes from. And really, for example, people respond to combat veterans who are struggling with trauma symptoms in a completely different way than individuals who grew up in, the east side of Baltimore, the southwest sides of Chicago, who have experienced the same kind of continued threat to safety in their environment and are having very similar neurobiological and physiological responses. People treat that differently based on the assumed context as well. So I think a lot of times, so we look at trauma survivors or people who have experienced prolonged threats to safety. And it can go to either one of the extremes of saying, oh, wow, I need to treat you like you're fragile because you've already experienced something and I'm worried about breaking you. Or, oh, wow, you're so strong. Look at everything that you've overcome, which is nice in theory and also is really dismissive for some people of their experience, or if they are having struggles and can maintain that myth that I'm strong, so I don't have a problem with this. I can't struggle with a trauma response with some of those difficulties, right? So I think it depends, but a lot of times the individuals who we interact with who have experienced community-based violence or other types of intentional trauma oftentimes are labeled, unfortunately, as in some ways deserving based on socio-demographic factors as well. Not that they deserve as a person for a bad thing to have happened for them, but if they did X, Y, Z differently, if they were not involved in this activity or this neighborhood or this thing without looking at the whole context as well. So it can be really different based on context, I think is my main point. And also, if we take that step away to say, overall, we need to be looking at people as everybody has different experiences. Everybody responds differently to even the same experiences based on prior learning and what they have in protective factors and other risk factors. And maybe let me not jump to a conclusion or make an assumption about this person, how they're reacting now, about what they maybe are involved with or not involved with, or what they're feeling or not feeling. Let me just take a step back and not make that assumption and treat them with compassion like a human being. And I'm not saying that people don't do that. Just if we approach people as people with lived experiences that are common across humanity, like suffering, it helps us be more compassionate and really change the perception that somebody who has experienced trauma is somehow damaged or broken or, unable to move forward in a way to go back to quote unquote normal. Normal might be different now. And also, resilience is absolutely possible. Post traumatic growth happens every single day. And individuals who we interact with, we don't need to know all the details to know that they're moving forward. I'm sorry. That was a little bit of a soapbox.
That's very helpful. And I no, but it's good. And my soapbox is box is always helping people with weight management and stuff. So I'm as you're talking, I'm thinking about the traumas that they've experienced, how people, just the trauma of being an overweight person in society. I mean, what does that look like? And then the last thing we want to do is traumatize them even more as clinicians. If we love them as a family member, although we're trying to help them, we may say things that harm them over and over again and not really understanding what their real needs are. So I think the trauma can just be, can go on and on. So I think, just having some perspective. Again, as I'm listening to you, I'm really starting to understand, where do I have gaps? Where can I do better? And that's what's so cool about this conversation. So, and on the flip side, when people are in this dark place, they really haven't gotten the help yet. What's your thoughts on how to bring people? I call it being in the darkness and bringing them to a joyful place. In fact, I got another way of asking this question. Talk a little bit about the process of getting people from maybe our ERs or walk-in cares, or maybe my office in the clinic, and then they come to you. Like, how does a person, they're going to get identified as a person who will benefit, and then what happens? I'm walking through your door. I've been traumatized. You're the expert who's going to help me.
Yeah.
Give us a feel for
So
what that process
really,
looks
first
like.
and foremost, taking that trauma-informed care lens of mutual respect and safety building and building trust. So following the person's lead, respecting boundaries, making sure as much as possible that we, as the trauma recovery center and in the relationship as well, and the interactions, that we are helping somebody to feel as safe as possible in those moments. And then in terms of the process of post-traumatic growth, so to speak, moving from that darkness into that light, it's really about normalizing. There is nothing wrong with you for having this response. And just because it is a normal physical and biological and emotional psychological response, that doesn't mean that it's not distressing. That doesn't mean that it's not scary. That doesn't mean that it's not uncomfortable. And what can we do? So helping somebody know that they have more control over that than maybe it feels like in those moments where things feel totally overwhelming. Yes, that is a normal response. And there are things that we can do about it to help it be less distressing. There are ways that we can help rewire your brain so that you're able to go out without, looking at any, something that's really common, especially with our younger gunshot wound survivors, any car with tint. They're hyper focused on that car and they start to get that physical response, right? Heart rate escalating, feeling kind of panicky. Their brain has already decided that they're in danger, even if they're not in that moment objectively threatened, right? So, what can we do to help you with that? Hey, instead of just looking at that car, that helps you feel safe because you know what that car is doing. Why don't we look at everything, including that car, which helps our brain orient, calm down, know where we are, know what's going on. And that's just one example of something really simple that you can also remind people of as a physician, as a clinician, outside of psychology, as a family member or a friend. Hey, no, look at everything. That helps our brain balance. But, doing some education, some basic coping skills building, and then finding the meaning and finding the purpose. Yes, this happened, and we cannot change the fact that it happened. And what are the values that are most important to you to help you move forward and live out those values? Do the things that you like. Yes, this happened, and yes, that's scary, and yes, it caused these disruptions, and you've got a choice. Are we going to live that way where you never go outside again, you never talk to anybody again because you don't know who you're going to trust? Or are we going to work with, does that sound very fun? It doesn't sound fun at all to me. That doesn't sound like a life I personally would want to live. So having that person be part of that conversation of what do you really want and how can we help you get there? So it's individualized throughout the whole process, but coming to a place of knowing we have automatic physiological responses when we feel threatened. That doesn't mean anybody's broken or damaged. There are things that we can do to slow down our heart rate, to slow down our breathing, to let our brains and bodies know we are more or less safe right now. And you have choice in how you respond, even when things feel really scary or overwhelming, or you're in one of those like trauma responses. And then getting them support.
It sounds, yeah, I mean, it just sounds like a lot of cognitive behavioral therapy and things in that scope.
That
You
is
haven't
a
said
big part.
medicines yet. So,
Yeah.
how
So
often does
depending
that
on the person
get
and their needs,
introduced?
I mean, if we
Yeah.
think about like Maslow's hierarchy of needs as a triangle, the basic things at the bottom are physiological needs, food, water, rest, and then safety. And then above that is psychological, social needs, and then, self-actualization, the thing we're all working towards, hopefully, up at the very top. If we're not getting those biological needs met, so if somebody's appetite or sleep is so disrupted by being activated by trauma, they're not sleeping, they have stomach upset, they're having panic attacks, those types of things. We need to get we need to get them at a level that they can engage in other things, that they can get those basic needs met. For some people, they don't need medication. A lot of people will benefit from medication interventions. There are specific things like beta blockers, and I'm not medical, so I cannot legally or ethically, make any kinds of recommendations there. But common treatments are, beta blockers to help manage those acute anxiety and hypervigilance symptoms. There are medications like prazosin that are specifically for, or not specifically for, but are used for nightmares and sleep, utilizing maybe a mood stabilizer or an SSRI type antidepressant to help keep things at baseline, and knowing that those medications do not necessarily need to be forever. They can be utilized. I think about it like reading glasses. You can read a menu at a restaurant, most people without their reading glasses on. How much easier, though, does it make it to be able to see things clearly and put those reading glasses on? You might hate the way they look. They might not be super comfortable. It might make you a little self-conscious. And also, now you know what you're actually ordering off the menu, and now you're ordering something on the menu. Medications are like that too. It is a help, and so is therapy. It is a helpful tool that can help make something you're already doing a little bit easier, a little bit more clear.
I feel like you're
Oh
talking
no, I
to
was
me when
talking
you
about
talk about
myself,
reading glasses,
actually.
because
It was just, I ordered something that I thought I was ordering something on the menu, and I ordered something that they didn't even have, but looked kind of similar with my blurry vision.
oh, really? That is too funny. Well, we have the same problem. Luckily, my contacts, they can kind of do the close in. So, but yeah, it's, I think somewhere around 46 or 47, things got crazy. And obviously it can happen at any age because you're much younger than me, but that's really good stuff. So what about, so you decide what's best for the patient. You spent over an hour with them. You have a team. What happens after they leave? I mean, is this a process where it's like a 6-month program, or how do you guys, because I know that I'm a big fan of coaching and things like that.
Yeah.
So what
So
happens after
after
that
our
first encounter?
really long intake, we have a conversation with the person about what are they really feeling is the most important thing for them. Because if you, again, think about Maslow's hierarchy, if somebody doesn't have a stable living environment, or if they are like constantly activated, we're not jumping into trauma processing. That doesn't make any sense. We need to build that stability first. So we work with the individual to see what is the biggest priority for them. And then depending on what they need, each person can be a little bit different. Sometimes it's education, cognitive behavioral therapy, kind of adaptive coping skills building to manage distress and for symptom resolution. Sometimes we do go, for some individuals, they want to, and there's the need to go into more of the trauma processing, doing like prolonged exposure, narrative exposure therapy, EMDR therapy, some of those types of pieces. And when we hit those treatment goals or at 16 sessions, but we're talking to people throughout, um, sometimes we are able to extend a little bit further, but we are grant funded. So we try to stick within the 16 session model. We work with people to make next steps. Are they wanting to continue therapy, traditional outpatient therapy somewhere else? Are they wanting to be engaged with our support groups that we have at the TRC? Do they want to reintegrate into a faith-based community that maybe they've lost touch with through the pandemic or through the experience that they've had that brought them to the TRC? Are they needing to rebuild some social support or get involved in something else? Do we refer them back to their GP to make sure that they are continuing to be well? And especially, to link that even with the weight management piece, when we're continuously activated and we have all that cortisol going, it is way harder to lose fat. We have more cravings for processed food, sweet, salty, sugary stuff, because it releases dopamine, and dopamine makes us happy. So what do we need for continued health management? Like, what plan do we need to have in place? And then, although we don't continue a therapeutic relationship, people are willing or able, if they want to, keep in touch with us. Let us know how you're doing. We care. We want people to be well. So it's about, after we do the therapy piece, what do you need? How do you continue kicking butt, moving forward and getting those needs met, and like doing the things and staying on that path of post-traumatic growth? And how can we help you get there?
Nice. We're lucky to have experts like yourself and to be in a health system, really a population health organization that thinks about the total person. And, I'm just curious, how common is a trauma center in a health center? And, so, because I'm thinking about people who are listening to this who may feel like, I think I need help, or I think a family member needs help. So what advice would you give someone who's not in Chicago, not with AdvocateAurora, but maybe in Boston or a place like that? What should they look for?
Yeah.
What should they be asking for to get help in this area?
I think that really depends on honestly what type of insurance you have, and I hate to be crass about it, but specializations
Yeah.
and availability depends a
Yeah.
lot on geographic area, payers and insurance plans and providers. What I will say is the biggest thing with resilience building is gratitude and perceived social support. So getting people linked, while there are cases absolutely that mental health, behavioral health is the best line at like 100%. If somebody is having panic attacks, somebody is feeling down, empty, depressed, or hopeless most of the day or most days or most of the time, we want to escalate that up to a higher level of care. You can always call your emergency services or go to a local emergency department if you are worried about somebody's safety or about the safety of another person to get a psych eval. I would absolutely recommend that if there is concern about safety. But in terms of getting connected, looking for a therapy organization or some type of support group or intervention that takes into account what you need. So, or what the family member needs. That is one of the biggest things is goodness of fit. Regardless of trauma-specific services or interventions, yes, those help. We have so much evidence and research that says these things are what is research. Goodness of fit and feeling safe and comfortable is the biggest thing in getting support. So looking for places that are willing to talk to you, to maybe do a quick consultation or a phone call that can provide you information and that what you're walking into if you do make the decision to get formal mental health or behavioral health care for family members who are maybe hoping to help somebody get connected, approaching that conversation from a place of compassion and non-judgment. So it's not the what is wrong with you? You need to go get help. You need therapy, not that stance on it. But I'm concerned and I care for you. I think this might be outside of my scope in how I know how to help. And I want you to be well so badly. I want to make sure that you have somebody who knows what to do and can really get you the care that you need.
I like that. As a family doctor, I know a little bit about everything and not enough about specific things except for low carb and obesity and diabetes. But that's not the point. The point is I like that a framing that you're saying, hey, I just don't know everything. I want to help you. Let's get some experts on board, not much to lose by taking that approach. So one thing as we get close to wrapping up, I want you to go a little bit further with this idea of, so many people listening may not have a specific traumatic experience that they can point to, but we all experience micro traumas, small traumas, and I want you to talk a little bit about, are the smaller traumas just as impactful in our lives as the major traumas? And just speak a little bit more about that, because I think that that'll really grab a lot more people in terms of how they perceive this trauma
so with
word
trauma,
and
we're
what it
not
means
only
in their
talking
lives.
about those big T single event traumas. To your point, we're also talking about little T traumas, those more day-to-day things that any one of those things on its own may not have such a significant impact. So I think about it like little T traumas being death by 1,000 paper cuts. Any one paper cut is going to be bothersome. It's going to be uncomfortable. One paper cut on its own, though, isn't going to make or break somebody's resilience and well-being. Somebody covered in paper cuts, that's a whole different situation. And it's really uncomfortable. It's incredibly impactful. I hope that we don't have people who have experienced that because, oh, goodness. But really, it's a cumulative impact and it's a cumulative nature. It might be things that wear away at our resilience factors, at our sense of well-being, at our sense of meaning and purpose, and that over time, can erode that sense of safety and psychological well-being and physical safety even. It might be noticing changes in behavior where you hear about on the news so often crime that's happening in your neighborhood. So you notice that you stop going out by yourself after dark. You stop parking your car in a certain place, or hear about on the news somebody being attacked in a stairwell. So you be sure that you're not walking down any stairwell that's closed off without another person, changing, patterns of behaviors. So there are those cumulative effects of stress that are buffered by resilience factors like gratitude, mindfulness, exercise, good nutrition, meeting those basic needs. And when that balance gets thrown off, you can absolutely be impacted in a very similar way to experiencing a big T single event trauma. You might notice your sleep starts to be off, you're more on edge, you're watching your back more, you're not trusting people, you're thinking about people, the world, yourself in a slightly less positive way, or even a lot more negative way, depending on the situation. So there is that cumulative building effect, and it's meant to keep us safe. When we start to feel on edge, and then we start to feel a little bit more on edge, and we start to watch our back, and we start to change our behavior, it can become this insidious cycle of, now I'm not feeling safe anywhere because there's a break-in in my neighborhood. And so I'm double checking and triple checking the locks on my doors, windows, those types of things. And we can have those trauma experiences from hearing about, seeing, living trauma content. And it can be a result of a lot of those little T traumas, those micro traumas, to use your language, death by 1,000 paper cuts, all the way up to just one response to that. And the best thing that we can do to mitigate the effects of any kind of trauma exposure or trauma content is take good care of ourselves. Find meaning, find the good, hunt the good, find the stuff that matters, find the reason why you do things, and try to find at least one thing, and not in a toxic positivity way where everything is all good. It's things are hard and this is still good. Things being hard right now do not diminish that I enjoy hanging out with my dog and talking to my family and eating Taco Bell every now and then, or doing this other thing, or being outside. Find a couple nice things, or at least neutral things a day. Practice gratitude, practice patience with yourself, and give yourself some space and some breathing room as well. I mean, those are the biggest things to mitigate cumulative effects of traumatic stress and chronic stress, as well as those big T trauma events.
Love it. And I know I had a chance to meet your beautiful dog. I think it was Ivan, right? And one of these days I'll have a dog, but I think that, yeah, those relationships are valuable. The time you spend with friends, family, and our pets is valuable. And I think these are great lessons for anybody listening to, help to heal from trauma. So I love that. So speaking of healing, let's think about your goals for 2021 and the year that follows. So when you think about your journey and you think about, the nest, the nutrition, exercise, less stress, more sleep, how we think, and of course, avoiding trauma. And then you think about the rope, which is relationships, avoiding harmful pollutants and organisms, protecting our emotions and our life experiences. Where does Dr. Vicky plan to focus her attention
Thank
so
you for this.
she'll
So one
achieve
thing
her ideal
that
state as well?
comes along with resilience from stress, and we're all experiencing some type of stress response from the pandemic. I mean, let's be honest, this is a collective trauma as well. So traumatic stress and responses can come from a lot of different things. The pandemic is one of them. I personally am going to cut back on my Taco Bell consumption and focus more on doing some really, ensuring that I am nourishing myself, my body, hitting my macros, hitting my micros, not being too restrictive about it. But when you eat well, you feel well, and that is incredibly important. And getting back into the habit of getting some physical activity in, even if it's not 45-minute high intensity workout, get to moving around. When I move around, I feel better. Taking a little bit longer walks, doing some stretching, taking care of my mobility, my joints, those things, I think more clearly. It helps me get better sleep and less stress, which is our S. And then in terms of thinking, really being mindful about what I tell myself, my job, my role, my responsibility, and also about other people. So changing my thinking to be a little bit less assumptive about what somebody is, and really assuming best intent from myself, having patience with myself, and assuming best intent from others as well. The best thing, if you want to be happy, practice compassion. I messed up the quote so badly there, but there's a really good quote. If you want others to be happy, practice compassion. If you want to be happy, practice compassion. And it really does. It reduces your stress level. When your stress level reduces, your blood pressure goes down, you get better sleep, you have less aches, pains, creaks, cracks, all of those things. It takes care of like your sleep. It helps you just feel better overall, be able to engage in things that matter more. So really compassion is, I guess, where I'm coming. Less Taco Bell, more movement, and more compassion.
Man, I love it. And I think my low carb followers will be happy to hear that. And I know that when I started movement more, even if it was, just a few push-ups and sit-ups, you just feel so much better. Even when you're walking down the street, you just feel different than if you hadn't done that. And so it's nice to climb the stairs every once in a while and not be short of breath and need oxygen when you get to the top of the stairs. So thank you for sharing that. And I just really appreciate the work you're doing. And I know our health system is fortunate to have your team doing this great work. So shout out to AdvocateAurora Healthcare for, understanding the importance of this. I was so happy when the team arrived on the scene, and I'm just excited about that. So any final thoughts and any thoughts on how people can learn more, or
So
if they have
I think big
questions? What's your thoughts
takeaways
on that?
are understanding that our brains are hardwired to protect us. We all are impacted by stress in different ways at different times. It's not a deficit. When stress gets overwhelming, there are things that you can do, and finding ways to cope adaptively that fit your lifestyle are incredibly important. So, making self care, taking care of your nutrition, your physical self, your overall well being, and your psychological and spiritual and social needs as well, in those increments and those ways that fit your lifestyle and that are doable and sustainable for you, is incredibly important. And those are things that anybody can do. We don't want to set those milestones to places that it's, New Year's resolution type goals that aren't necessarily always achievable, but or are achievable, but we don't always necessarily have the motivation to follow through with. So finding ways to incorporate small changes, build your resilience bank up so that if you are experiencing some stress, you have that to fall back on. You can get back to your day to day without having that impact. If you have questions about traumatic stress and you are in the Chicago or general area, you can reach out to the Trauma Recovery Center. We do have a website. If you Google Advocate Trauma Recovery Center, the National Traumatic Stress Association Alliance is a really great resource as well. And I can give you, Dr. Hampton, if you'd like, a couple of links for some general information about trauma responses. And please know, if you've experienced any type of big T trauma, long-term interpersonal trauma, or anything like that, or you know someone who does, you can move forward in a way that feels meaningful to you. And it may be difficult, and we're not saying you can forget about it or everybody should just like move past it at all. But please know that you can find meaning, you can find purpose, and you can continue on and like keep kicking butt, even without the help of a professional. But we're here, we help. Finding that support is a good tool.
Nice, and thank you. And I love you referenced kicking butt a few times, and I just love that because we do want to kick trauma's butt and put it in its proper place. And if it teaches us to be stronger and make us more resilient, I'll receive that well. But we're definitely going to kick trauma's butt. So thank you for being here today. I really appreciate you and just sharing a piece of yourself today. And also, always nice to have those within our health system to kind of help me on my journey as we share messages of healing. So thank you again. And
Thank you
I
for
just
having me.
appreciate
This
you.
has
So
been
thank
great.
you so much. Oh, yeah, a lot of fun. So, guys, our foundation as it relates to trauma is now much stronger. I just want to remind everyone who suffers from rather it's a major trauma, a micro trauma, consider using those experiences to become stronger. And at the same time, with the new wisdom you've acquired because you're stronger now, you can use that wisdom to help others who may need your expertise, because now you're the expert. You've been through it. So I think for all of us who have suffered trauma, it's time to retell our story. There's a great storyteller, Wesley Chapman, and there's another YouTube video I'm going to link, and it's another TEDx video, and it's entitled "Building a World of Worth." And he's inspired many people with his YouTube video, and that's what you're going to do as you share your story. And a great quote from Wesley Chapman stated, and I love this quote: "Put the victim to bed, wake the hero up instead." And I love that quote because we all have the ability to be superheroes, heroes. So just think about it. What superhero have you seen who has not experienced trauma, right? And instead of letting the trauma, take over, they rise up much stronger than ever before. So if you've suffered a traumatic experience in the past or even now, get help, as the doctor has suggested, but never forget the great power that lies within. You're not defined by what has been done to you. Tomorrow is a new day, and help is right around the corner. So as we close, just a reminder to check out my article in the low carb corner, where we talk a little bit more about trauma from a different perspective. And I think that article will be very helpful as you overcome trauma, if that's something that would benefit you or your family. So I hope my guest today has added value to you and your life today and in the future. And as we wrap up, I only ask that you be safe, be well, and continue to protect your nest. And thank you again for being with me, Dr. Victoria. Take care.